Hey, my name's Josh. I'm a third-year resident from Central Washington Family Medicine. I'm going to show you around our hospital in just a bit here. But we wanted to start with Tieton House. This is a house just right next door to the hospital where our residents hang out at. There's workstations for you to get your work done at with dual monitors. There's also a TV room to hang out in, some workout equipment, and lots of places to read and relax. So let me go over to the hospital with you and show you around. All right, this is our main physician lounge here in the hospital. While all of the doctors come in here and work together, as you can see, it's also got mainly residents and our faculty here working hard. Behind me here is the auditorium. We are currently using this primarily for COVID rounds, but in non-COVID times, we use this auditorium frequently for educational lectures, presentations, including OB grand rounds and maternal fetal wellness grand rounds. Here in our basement, there's plenty of classrooms for other learning if it needs to take place. We also have infusion care just down the hallway, and then behind me is wound care as well as hyperbarics. This is our telemetry unit or acute care unit. This is where we see a lot of our more sick patients and also our cardiac patients. One thing that's nice about our hospital is it's very easy to run into our cardiologists who are usually here in the earlier hours and have conversations with them just in person. This is one of the rooms where we do our rounds in, so we're able to meet with pharmacy and each other and talk about our cases. We also have a TV in here for radiology rounds, which are on every Friday. Here's our radiology department here on the main floor. We have the second busiest ER in the state, so plenty of learning opportunities. This is the entrance to outpatient surgery on the main floor. Right behind me is the entrance to the cath lab, and right above us is our psychiatric unit. Here we are in the pre-op area, and just behind me over there is the underground tunnel that goes across the street to our surgical center. Here on the second floor, we also have the ICU. Our ICU at this hospital is an open ICU. It's currently 11 beds. Because of the demands of our community, we're actually going to be increasing the size of this to over 20 beds in the near future. Here on second floor, we also have our Oncology Wing. This is our third floor, another general medical floor. Here on the third floor, we also have NICU, so if you ever need to go take care of those patients, this is the way in. And here on the third floor, we also have peds. So this is the fourth floor of our hospital. This is the OB floor, or what we call the family birthplace. Let me go ahead and show you around. So this is our OB lounge. This is where the residents will often hang out when they're not seeing patients. We also do our didactics in here as well. There's lockers to keep your stuff. There's 3 different call rooms that you can sleep in. And also there's a TV with a Chromecast. You can watch your favorite shows on Netflix. And then if you need to, you can practice with all the models and suturing materials we have here. This is one of our OB-ED rooms. So this is where the patients will come in for OB when they're first evaluated. We still have NST monitoring, but we also have central monitoring as well. So when you see your patient for the first time on the OB floor, it's usually in this room before they're triaged to another room, and we'll show you those as well. This is one of the outpatient rooms on our OB floor that can be used for when we do external cephalic versions or an outpatient NST monitoring. This is the overflow area of our OB floor. Yakima does a little over 3,000 vaginal deliveries every year, so when it gets busy, it's nice to have an overflow area like this. This is the OB surgical area, so this is where we have 2 ORs that are dedicated to just OB. So this is one of our nurse stations on the OB floor. So as you can see, we work closely alongside our OB nurses and our OB hospitalist. One nice thing about our OB floor here in Yakima is even though we have our attending available at all times, we also have a dedicated OB hospitalist who's here 24/7. So if you have anything come up that you need help on right away, they're always here. So this is one of our standard OB rooms. As you can see, they're pretty generous in size. There's also a pull-out bed there for if a partner wants to stay. The other nice thing is that all of our rooms are room in with baby. So if you're taking care of the baby as well, they'll be right here in the room with mom. So this is one of the stairwells in our hospital. Kind of the fun fact about our stairwells is they're completely original back to when the hospital was built, and they have these frame pictures all throughout so you can see the history of our hospital. So while the rest of the hospital has been modernized, it's like going back in time every time you use the stairwells. This is the cafeteria here on the main floor. One perk of our program, our residency program, is that they compensate for all of our meals so we don't have to pay for anything. Just outside our cafeteria, we have our Atrium area. It's an outdoor area that you can use to sit outside in the beautiful weather, chat with others. We also have a farmer's market that occurs once a week in the summertime, which is really great. Thanks for joining us on a tour of our community hospital here in Yakima. Come and see us soon.